everybody, this is Azar, physical therapist again. Today we're going to continue doing some sessions for sacroiliac problems. Last time we went over some self-adjustment for the sacroiliac issue. Today I'm going to continue with self-adjustment and give you some strengthening exercises for that and some other exercises you can use for your sacroiliac issue. We have been talking about the unevenness of the pelvis. So the side of the pelvis that is hiking a little bit because of dislocation of the sacroiliac or subluxation of the joint. The part that hike up, we can do this exercise. I'm gonna put that very hard elastic band, usually the black band, on some area that's really that's very stable, like the big table or very heavy duty table or something, and you can apply that pressure to your ankle. So basically you're hanging it to your ankle and you're gonna bring yourself backwards while your foot's hanging to that elastic band. So basically that pulls your pelvis nicely, the side that's hiking, the side of the pelvis that's shifted up, that's gonna depress that side of the pelvis, hopefully making it even. You can hold it even up to 30 seconds and release. Okay, we go to physical therapy clinics. What the physical therapists usually do, they can adjust you with pulling your leg. The side of the pelvis that hiked up, they're gonna pull that leg to get rid of that pressure up here, and hopefully they can adjust your pelvis. So if you want to self-adjust at home, especially if you already talked to your physical therapist or you know that that's the solution, so you can hang your leg to the elastic band while your elastic band is attached to something really sturdy, like a big table or something, and then pull your leg. So the next thing that I wanted to show you for helping your sacroiliac to get adjusted, especially if you're hypermobile, you're gonna put that belt. We already talked about sacroiliac belt, right? I wanted to show you. This belt is very more narrower than the back brace, so you can put it on. So it has two parts, but you're gonna put it on your buttocks area, right? Like on your sacroiliac joint, okay? And then what you can do, you can go ahead and put it on your buttocks, okay? And just two sides to make it even more stable. So you pull them forward, and this is gonna give you a good stability on your sacroiliac. You can put it underneath your clothing while you're working or something, okay? But if you think that when you do that, that's pushing your sacroiliac more forward and it can opens up that unstable sacroiliac more, sometimes that makes you more uncomfortable. So what we can do, we can open it and we can reverse the belt. So we're going to bring it forward, okay? And then you're going to go back down on your butt. Grab these two and make it more towards the back. So that kind of makes your sacroiliac joint more towards backward. Depending what deformity you have, you can use the belt in different situations, okay? So the next thing you could use, after we went over the belt, I'm going to show you a couple of exercises that's very familiar for you already. They are common between hip and sacroiliac and the lower back. We already went over that in the lower back, like glute strengthening exercise and performance strengthening. But you really need to do that maybe one-sided. Depends on which side of your pelvis is shifted forward and you want to bring it backwards. So you're gonna do it. Again, if this side of the pelvis shifted forward, so you want to do it on the right side to bring it back. Okay? Either with this motion or especially with this motion. Stabilize your abdomen and let your pelvis rotate backwards because your pelvis is rotated forward, right? You want to fix that. You don't have to do it both sided if you're trying to self-adjust with the muscle energy. Okay? Another technique you can use for sacroiliac would be your core strengthening. Your friend, of course. You can grab this. Strengthen your core. It's going to help your sacroiliac to get more stable as well. The same as the back. Another thing you can do that muscle energy on the bar. So imagine this right side is rotated upwards. So you're going to press with the right side down. And you're going to press onto your hand on your left side towards the ceiling. And if this is rotated this way, you're going to do opposite. Press with this leg down. And press the other leg towards the ceiling. Okay? These are some easy fix for the sacroiliac joint. Of course, you can do a lot of pelvis tilt. We already showed you the pelvis tilt, right? This tilt can help you with rotating your pelvis to the better situation. Depends on what you need. You can do performance stretch. Sometimes performance got tight, and that's how your sacroiliac became rotated. So you can do this. Very famous performance stretch. Hold it for 30 seconds. We already went over that on the lower back. That's another way of doing this. Okay. Another way of performance stretch. Okay. You can also do hip flexor stretch. That can be a little bit more advanced hip flexor stretch like this. So we're stretching the hip flexor on the left. Let me show you the right side this way. You can see better. Gradually bring your body forward without bending forward. Stretching, hold, relax. I'm going to show you this one here. Stretching your hip flexor. It's like lunges. And relax. These are good stretches for sacroiliac also. Hip flexors and performance. We can do some advanced core strengthening exercise, which I haven't been showing you before. These are more athletic exercises, but at this point, if you don't have a pinch on your lower back, you might be able to easily doing some plank. So keep your pelvis down, get on your elbows and your feet, tighten up everything, and hold. You can do side plank, like this. Okay. Side plank on the other side. Okay. Basically, a lot of these exercises are common between, again, your lower back, sacroiliac joint, and hip joint. So you can even do a lot of opening, just like yoga pose, crisscross. That can help you to readjust your sacroiliac sometimes. Okay. You're going to hear more about this on the hip section, which is like a real hip joint, the ball and socket hip joint, in the next session. And you have been hearing a lot on that in the lumbar spine section, so they're overlapping again. Thank you for watching. Hopefully you can get a consultation of your physical therapist and chiropractor or your doctor. And with that, you can use these techniques as a home exercise for treating your sacroiliac issue. Thanks for watching. Again, if you like our channel, please subscribe and follow us and exercise with us. Have a great day. Bye-bye.